Today I'm breaking it all down for you, the real pros, the real cons, and everything that's new in 2025 for Medicare Advantage plans. But make sure and stick to the end because we're going to be going over the simplest way to choose the right plan for you in 2025. Medicare Advantage, also known as Part C, is an all-in-one alternative to original Medicare, Medicare Part A and Part B. These plans are offered by private insurance companies and include Parts A, B, and often Part D of Medicare, plus extra benefits. In 2025, over half of all Medicare beneficiaries are now enrolled in Medicare Advantage plans. Why, you might ask? Because of the extra perks and lower premiums. But we'll talk about the trade-offs in a minute. Now let's start off with the pros, and there are a lot of them. Number one, there are low or zero monthly premiums. Some of these plans in 2025 have zero premiums while still covering your Medicare services. So you won't have to pay any premium extra besides your Part B premium, which this year in 2025 is $185 a month. The second pro is extra benefits. Vision, dental, hearing, gym memberships, and even grocery cards come with some Medicare Advantage plans. This makes them extremely competitive because you don't have to go and get a separate plan for your dental, vision, and hearing or your drug coverage. It's all going to be built into one plan with one card. Which leads me into pro number three, which is the all-in-one convenience. With Medicare Advantage plans, you have one plan, one card that covers your hospital, doctor visits, prescriptions, dental, vision, and hearing. Anything that you need to get done is included in one card. Pro number four is the out-of-pocket maximums. Unlike original Medicare, Advantage plans have a cap on how much you can spend annually called the maximum out-of-pocket. Now, typically these maximum out-of-pockets range between $1,000 up to about $5,000 or $6,000 for most Medicare Advantage plans in the United States. However, there are some states that have significantly higher maximum out-of-pockets on their Advantage plans, closer to $8,000 to $10,000 a year. The fifth pro for Medicare Advantage plans is affordable copays. Most people are very surprised once they actually look at the different copays and coinsurance on their Medicare Advantage plans, because a lot of times they're more competitive than a group plan or a private health insurance plan that you may be on right now. Now let's get to the negative part. Let's talk about some of the cons with Medicare Advantage. The first con of Medicare Advantage is that you will have certain doctor and hospital networks that you must stay within. So unlike Medicare Supplement or Medigap plans, Medicare Advantage plans have certain doctor and hospital networks that you have to stay within. Now, they have done a lot with broadening those doctor and hospital networks, but there are still networks that you must stay in. So if you're someone that's planning on traveling a lot, or you live in 2 different states throughout the year, or you just want to have the most freedom possible with your Medicare plan, Medicare Advantage may not be a great option for you. Con number 2, prior authorization. So you know that MRI your doctor wants you to get? You may have to wait days or even weeks for that approval. Now, I'm not saying every single time that you need to go to a specialist, you're gonna have to get a referral or get prior authorization, but it happens more so on HMO Medicare Advantage plans than it does with PPO Medicare Advantage plans. So keep that in mind because people typically have more freedom on a PPO Medicare Advantage plan. The third con is that it can be hard to leave these Medicare Advantage plans once you start them. Now, what I mean by that is you will have to health qualify to get off the Medicare Advantage plan and join a Medicare Supplement or a Medigap plan. You can't just do it any time of the year. There are enrollment periods and you do have to health qualify. Now, it's important to note that they're not going to require you to run a marathon or anything like that, but they are going to want you to be in pretty good health. So now that you know the pros and the cons of Medicare Advantage plans, let's take a look at what's new in 2025. In 2025, CMS, the Centers for Medicare and Medicaid Services, has added more rules to protect you, the consumer. 3 new rules that come to mind are: number 1 is more transparency in all the different plan ads. Number 2, stricter limits on cold calling. And number 3, improved comparison tools on Medicare.gov. The goal for these efforts from CMS is to protect you guys, the consumer, of getting scammed out of the benefits that you deserve. And I, for one, am happy about it because I was tired of seeing all the misleading commercials and ads just to get people to call in and switch their plan to a worse plan. And I'm tired of all my clients getting 20 or 30 phone calls a day cold calling. Now, at the beginning of the video, I told you if you stick around to the end, I'm gonna give you a checklist on how to make sure you get on the best Medicare Advantage plan in 2025. So here's 4 things that you have to make sure that you do before enrolling into a Medicare Advantage plan. Number 1, you have to check if your doctors are in network. It's a non-negotiable. You have to check and make sure that they take the specific plan that you're looking at. Number 2, you have to compare your drug coverage and copays. With all these different Medicare Advantage plans from all these different companies, they have different copays and they have different coverage when it comes to specific medications. So you need to check both with the plan that you're looking at. Number 3, you need to look at the extra benefits and actually use them. All these different Medicare Advantage plans have different amounts that they give for dental, vision, hearing, and all these extra benefits. So you want to look and see which gives you the most. And number 4, you want to either use Medicare.gov's Plan Finder or talk to a licensed advisor that can go over all the different options in your area with you and help you enroll. Now guys, if you want to learn more about Medicare Advantage plans or even Medigap plans and all the plans in your area, feel free to call the number on the screen. My name is Tim Smith and I'm the owner of Smith Insurance Solutions. And I would love the opportunity to talk with you, go over your options, check your doctors, your medications, and your pharmacy, and see how we can help you. It's all 100% free of charge, so you will never pay us a fee whatsoever. So if that's something that you're looking for, feel free to call the number on the screen or text the number on the screen, and I will get in touch with you and see how we can help. Other than that, thank you so much for watching this video all the way through. If you guys have any experiences with Medicare Advantage plans, feel free to put them in the comment section below. It helps people to see your experience with them and ultimately decide if they want to take one out. And don't forget to hit that subscribe button. I'll see you guys in the next video.